Sorry about that. I actually did not realize that I was muted, but I would say good evening, good afternoon, good morning from wherever you're watching us. Welcome to the Tower at UNN. We feel honored and blessed to be here today. I'm here today with my co-host, Senior Kintu, and to be here with you today to discuss, patent issues that relate to our own liberation, our nation, and also our neighbors. So we're glad that we can be here with you today. And before we get into today's topic, where we're going to be talking about rebuilding of Uganda's healthcare system, we're first going to listen to the national anthem as we always do, and then a senior Chintu will come to, greet all of you in the audience, whether you're listening to us or watching us, and we will listen to state anthem. So I'll ask our producer to please go ahead and play the national anthem.
Oh, Uganda, may God uphold thee. We lay our future in thy hand. United, free, for liberty, together we'll always stand. Oh, Uganda, the land of freedom, our love and labor we give, and with neighbors all at our country's calling, peace and friendship will be.
Welcome back from the national anthem. I'd like to invite my co-host Senior Chintu to come and greet our members in the audience who are with us today.
Thank you very much, Desire. Ladies and gentlemen watching us and listening to us today, we welcome you to this special program whereby we are going to deal with some serious issues regarding the health system in Uganda. Everybody knows it is a dilapidated health system. I am sure every Ugandan inside Uganda, and maybe even outside, knows of a relative, a friend, or an acquaintance who has died at the hands of the medical personnel in Uganda, not because they wanted to kill that person, but because there is no service. I recall one person told me that you are taken to Mulago Hospital to die, not to be cured. That's what we are trying to talk about today, to see how a new Uganda, after we get rid of this NRM regime of invaders. We welcome you to this program, and we hope we shall exchange some very good and productive, constructive ideas. Welcome to our program.
Thanks so much, Senior Chintu, for that. And we will listen to Bunyoro's state anthem before we start today's program in its totality. So I'll ask the producer to please go ahead and play that as well.
Nitwituke
And welcome back to the Tower at UNN. Today, what our main topic for the day, we're going to be talking about rebuilding Uganda's healthcare system. But before we get into that, health is very important to everything that we do. For us being able to, carry out our day-to-day duties and service ourselves and help the people in our communities. Health is a very important factor of everything because without health, you can barely do anything else. So we have to lead with that foot whereby we look out for our health in general as a people, as a collective especially, and as a people organizing ourselves towards a struggle. Our health as a group is important, but in order to get to that, we have to look out for the health of people within our group as well. And the only way we can facilitate that is if everyone does their part. If not everyone's doing their part, there's always going to be an imbalance in load. And once there is an imbalance in load, then we will start to see that in the ripple effects. So, with that being said, I want to welcome all of you to today's show. Today, we're going to talk about a little bit about how we can rebuild and remodel our healthcare system to be able for it to function for the benefit of the people. And it's a little bit of a comparison analysis and a leaning into what Cuba has done with their healthcare system, as it is one of the world's best healthcare models that exists to this day, that has been able to serve the people within its nation and also serve people beyond borders. And a little bit of it also is Senior has managed to also propose something that would work for Uganda as it is. So it's a reapplication of what has happened in other places to also our nation and what that would look like in a federacy or in the federal state of Uganda that will be bringing together all these different nations, how we can model how we can model a healthcare system that is able to serve every state and also have partnerships alongside states and really boost our national healthcare system. So, with that being said, I'd like to invite the senior back to the show so that we can now dive deep into the show and start looking at the work that we have prepared to go through today.
Thank you very much. Well, first of all, I want to make this perfectly clear.
Mm,
Neither me nor Desire is a medical doctor. So we cannot
exactly.
approach this issue from a professional point of view because we
Mm,
cannot provide any professional clarification about the services. However,
mm,
we can talk about policy, and this is what we are going to concentrate about policy
mhm,
regarding medical services in the country. Secondly, the presentation we are going to make regarding how the medical services in Uganda should be restructured is a
mhm,
product of teamwork. And that teamwork does not include medical professionals at all. But we have people who have contributed ideas, and some of those people are inside Uganda, others are outside Uganda. A good many of them are outside Uganda. And they have looked at what is going on in our country and suggested these ideas we are going to bring forward so that you too can look at them. And of course, you have the right to expand, subtract, or multiply, divide, whatever you can do when the
mm,
time comes. These are coming as our proposals or our ideas about how the medical services should look like under a federal system of government. I don't think there is any genuine indigenous Ugandan who could stand up today and tell us that it is okay the way NRM Madras regime is running the medical services. I don't think there is such a person. Even if I went to Butabika Hospital, none of their patients would even come out, in spite of their predicament, could recommend that what is going on in Uganda is okay. It's horrible, absolutely horrible,
mm.
just as horrible as what we showed you recently regarding the way the police department in Uganda is run. It is sickening and it makes one so mad that we got to do something about it. We cannot sit here and be quiet. No.
And with that being said, I would like to ask the producer to please put up some of, start the slideshow that we would like to share from for today's program. So principally, we're looking at universal healthcare, a healthcare system where the principle is that uh, health itself is a universal human right and a state responsibility, one that ought to be given to the people by the state, and also one which is considered a human right whereby no individual within any state goes without healthcare services. So, Senior, when we look currently along the lines of what you said, Uganda's healthcare system, we have a private healthcare system that only serves the rich. But even in Uganda, the private healthcare system is not that strong that sometimes when the rich or the privileged cannot get serviced to the best of their abilities by the private healthcare system, they opt to fly out and go to other countries abroad, as many of them have died in Nairobi, in the US, or somewhere in India. And then we also have what we call the social security healthcare system in Uganda, one that is given to employees. And these are people employed by organizations such as the NSSF. In most cases, they're civil servants or they work for private companies, which are or corporations. Those are the ones who have the social security healthcare. And then there is the underfunded, dilapidated public healthcare system, and this is the one that is servicing most of the indigenous population in Uganda. It's underfunded, dilapidated, very embarrassing. almost when you walk into Mulago Hospital, what you see today, or when you walk into a healthcare facility all the way in Karamoja or Choli, what you see today, people laying on floors who are in critical conditions, not having separation for people in critical conditions, and people doing better. So this is just to paint a picture of what the current healthcare system in Uganda is. It's divided along everything: class, region, and even need for care. It's divided along those lines. So if we could go to the next slide, please. So these were some of the goals, and Senior, if you can please go into them in detail. The goals of offering adequate and acceptable healthcare service. The first one was timely access to quality healthcare for all Ugandans, to maintain a healthy population, to stop the calamity of infant mortality, and also eliminate any possibility of mothers dying in childbirth. So these are some of the goals that brought about today's presentation, and I would like to invite you, Senior, to go into detail why these specific four are important for a nation that's looking to rebuild and have a legacy that has longevity as well.
Yes, this is very, very important after we have seen what these uh, murderous NRM bosses have done to our country. For them, when they
Mm,
get sick, they can jump on the plane and they go to Nairobi or India or Germany or United States and they get treated. But how about the person, the common person in Apache, the common person in Masindi, the common person in Matuga, the common person in Ruhengeri, where that person is not going to fly to Germany, and yet
mm,
is the Ugandan. And you are telling me that you are here to serve the average or every Ugandan, which is a lot of nonsense. They are not doing it. When you
mm,
talk about uh, social services, uh, we call it social security services. For people say, if I am working for some international organization, it gives me health services. And what
mm,
if I get sick? They will fly me to Nairobi. So the company I'm working for will fly me to Nairobi. But that's not what the other Ugandan farmer in Ibudu or Maokota or even
mm,
Kamuri will do. Now, what to solve all this problem is to have a medical service system that serves everybody, whether you are the big man or the small man, no matter what.
mm,
Medical service should be accessible, timely accessible to every Ugandan in the country. In other words, if someone is sick, people should be able to have access to good, professional, and efficient medical services, regardless of their position and status in society, regardless of the economic status in the country, and also regardless of the distance where from their home to the next hospital. There are many
mm,
people who cannot access medical services because they're about 50 or 60 miles away. And even if they are 2 miles away from the hospital, there is no way of delivering them to the medical facility. I recall myself some years ago when I was in Uganda, I saw a man who had put his wife in a wheelbarrow, pushing that wheelbarrow from Kabaragara to Nsambia Hospital. The poor guy was sweating, pushing a wheelbarrow through traffic with a dying woman in that wheelbarrow. It made me sick to my stomach. But then I have seen worse pictures like that, especially in eastern region and the northern region. People being dragged miles, and at least Kabalagala and Zambia was, you people who know Kampala very well. Kabalagala and Zambia is not too far.
And not
But
too far
regardless,
away.
it's not too far away. But it is
Mm,
so damn far away if you are putting this sick person in a wheelbarrow. There is no
mm,
ambulance. So what we are saying is there must be timely, timely and accessible quality health care for every Ugandan wherever they are. And we are saying the goal of the new administration after the NRM hooligans are gone will be to make sure that we can provide everything that we have and our power to deliver and maintain a healthy population in Uganda, because healthy people are the ones who are going to produce whatever is required. Healthy people are the ones who are going to consume whatever is required. Health people are going to be the backbone of what we call
mm,
GNP, gross national product.
mm,
It is the health of the population that is going to build the country. And there is no shortcut to that. We have a problem of children dying before they reach the age of 5. The World Health Organization has written very extensively about this problem. It is all
mm,
over Africa. But in Uganda right now, it is worse. I don't have the exact figure, but I can estimate that at least 30% of these kids are dying before they reach the age of 5. It's horrible. That shouldn't happen. Not in Uganda, 60 years after we got independence. Another problem is women dying in childbirth.
mm,
You all have heard of stories that they would take someone to whatever they call a health clinic or health center. Then whoever is running that little health center says, "Oh no, this is beyond our capacity to deal with. I think you should take this woman." I heard of stories like that from Kyotera, which is where I come from, or take this person to Masaka. We are talking about 26 miles away. There isn't even an ambulance. Or look for
mm,
someone to take the person, and the person is dying. Then they
mm,
try to look for who can help us drive this person from Chotera to Masaka, which is 26 miles away. But there are other places where the distance is even worse than that. So what we are
mm,
saying is we have to design a complete and a comprehensive health services so that there is no such a need of referring this person from this particular location to 30, 40 miles away. And then you get there and the doctors tell you, yes, we would be happy to help, but we don't even have the machine. There is no
mm,
x-ray. There is no, what do you call it, MRI machine. We don't even have oxygen. We don't have supply of blood to do blood transfusion. We don't even have the right medicine to take care of this problem. And then the person ends up dying there simply
mm,
because some character in the Ministry of Health stole the money which was appropriated for this kind of service. In other cases, you're going to find that the
mm,
doctors or the administrators there, they receive the medical supplies, then they steal them and take them in their private clinic. And then at the same time, they are going to tell you, well, we understand your problem. Now, if you want to be cured, I think you need to go down to Hobart Street and buy that medicine, and then they tell you it is going to cost 5 million shillings. This poor fellow from the village doesn't have 5 million shillings.
mm.
That is why we are proposing universal free medical services to everybody.
Yeah.
Universal free medical services to everybody.
Mm,
Nobody should be asked to pay 10 million shillings, not even 10 shillings to obtain medical treatment. Nobody should be charged that kind of money.
That definitely makes sense for a nation that is dedicated to its population. I'll ask the producer to go along onto the next slide, as what we're talking about now is going to start to be more apparent to our audiences as we go through the slides. So, UFCC will propose that under a federal system of government, the following measures shall be taken to review the dilapidated medical services. The first one is that medical services will be free of charge to all patients. That is, no person shall be required to pay any money in order to obtain medical treatment in Uganda. And we're going to see a good example in Cuba and how they've done this. And then each hospital must have a minimum of 2 functioning ambulances, if we're talking about it logistically. Regional and referral hospitals have at least 5 ambulances. There are currently thousands of vehicles in the hands of public thieves who are busting in ill-gotten wealth, which involves a number of vehicles per person. Those vehicles shall be repossessed and converted into ambulances by our craftsmen at Katwe and other similar places in the country. The converted vehicles shall be distributed to hospitals throughout the country. The remainder of those repossessed vehicles shall be distributed to schools and other public institutions. So, Senior, let us talk about, as we have talked about the first bullet point, let's talk about the second bullet point, which is logistically, how we as a nation can repurpose the waste that has been demonstrated by this regime and repurpose all those facilities for the advancements of our nation. A good example that I can remember in this was when Magufuli came into office, how how he stopped parliamentarians from having all that much material wealth from the government itself and repurposed it back for service purposes. So, if you could please come and break down more for us how, because the different cars that are in parliament and have been used by the people who are meant to serve the public, they vary. They have vans, some of them have big cars, some of them have the fancy small Mercedes. So, how will we go about the repurposing of these vehicles into different facilities and services? Do we even sell off some of them? Because the speaker, remember, has that very expensive car that is made all the way overseas, that is specially made for the speaker to drive, and they get that every, what was it, 2 years? So, how would we go about something of this sort?
Well, the good thing about it, that speaker will not be there. So we cannot talk
Mhm.
about a person who is not going to be there. So forget that
Yeah.
Mercedes Benz. We'll find a way of
Mm,
dealing with that. However, look at these other people. Let me put in
mhm,
some names. How many
mhm,
vehicles does Second have? How many vehicles did Eri Tumwine leave? How many vehicles does Mbabazi have? How
mhm,
many vehicles does Kahindo Tafile have? How many
mhm,
vehicles does Salim Saleh have? If you look at all these people, you're going to find that each one has at least between 5 and 10 or even more. Now, those vehicles, and the good thing about it, none of those vehicles is a small VW Beetle. No, they are not. They are not small VW Beetles. They are very expensive SUVs which can easily be converted into ambulances. They will be repossessed. Or the other
mhm,
word we can use, they will be confiscated from these people because they did not earn them honorably. They have stolen from public coffers and they are going to be stripped of whatever they stole. Well, let me borrow from my Christian faith. If you confess for having stolen, you are you are demanded to return what you stole. Well, I don't think these people are going to go for confession and be advised to return what they stole. We are going to make them return what they stole. Now,
mm,
the good thing about Uganda, we have very crafty people in areas like Katwe and many other locations around the country. If I gave them that Kahindo Tafire's SUV, they can easily take out the back seats, convert it into an ambulance very easily. It will take them a week or so. And they can do a
mm,
good job about that. We These are the vehicles we are going to distribute. We are saying that there are, I think, two or three levels of medical services. There is what we call the referral hospital, which we'll talk more about this later. And then we have what
mm,
we would call regional hospitals, which must be complete with all the basic services a hospital must have. Each hospital must have at least two functioning ambulances. And I can envisage that there are more vehicles than the hospitals will be able to absorb. These kind of
mm,
hospitals. I mean, if they can raise money, the the grandchildren of this Badehemuka can raise money to buy an aeroplane, and you had the list of those pharaohs contributing 400 million, 300 million, so many millions. I mean, they're talking in hundreds of millions. If they have that
mm,
kind of money, you can imagine how many vehicles they have. So those vehicles are going to be converted and are going to be distributed to these hospitals. So now the
mm,
bigger hospitals will be given at least five ambulances. So much so that this man I've referred to in Kabalagala doesn't have to put his wife on a wheelbarrow. Can make a
mm,
phone call to Zambia Hospital and they'll send an ambulance to Kabalagala in 2 minutes. The woman is delivered to the hospital, she's treated, and okay. If it's a longer distance, then there is an ambulance there that can speed this woman from Kyotera or Kalisizo to Masaka if the hospital in Kalisizo cannot deal with it. But, and of course, being an ambulance should have a staff, trained staff, working on it, taking care of this sick person before he's delivered to the emergency room of the other bigger hospital. Now, that being said, can you imagine? Then our kids who are going to be trained in these services don't have to go to Saudi Arabia and die as slaves. There will be enough jobs. First, you will
mm,
have a driver who, the guy now who is working as a slave in Dubai could be a driver of this ambulance. Can you imagine how many drivers there are going to be? And then these young people, and the funny thing about it, and I will tell you what I'm seeing here in America, a lot of our African people, including Ugandans, are now becoming the backbone of the medical services in these developed countries.
mm,
They can go back and they could be the nurses, the radiologists, the x-ray operators. You know, you can imagine all the services that will be required in these hospitals will be manned by our Ugandan kids. And that is going to open up a whole new door of employment for our people, training them even in better and more skills. And there is no need to send our kids to die as slaves among the Arab countries. That will that will stop. There will be enough jobs.
mm. It's the irony in the children or the grandchildren of this social elitist class to be able to collect money to buy an airplane. Uganda as a nation, we can't even afford our airplanes that we have underneath our airline. That should already signal a lot. But also, we haven't even started to talk of having helicopters for airlifting purposes to hospitals. We're even struggling. Where we don't even have ambulances. We can barely have helicopters to airlift people in emergency situations into hospitals who need to get there fast enough. And a clique of people can come together and collect money for a private airplane. We're in trouble. So I'd like to ask
Yes,
the producer.
y-
No, go ahead,
that
Sonia. I just
that
wanted to send
helicopter.
that.
Thank you for mentioning that helicopter, which is supposed to fly the widow of Eri Tumwine to go and look after her cows and fly back to Kampala. I am glad they are going to buy that helicopter because when the time comes, they may not be around to sit in that helicopter. That will be one of the helicopters we're going to start with that serves emergency flights of sick people.
Mm,
For example, if someone got into a very, very serious accident
mm,
at Wabigaro, let me use that, Wabigaro near Mitiana, and the kind of accident or the kind of damage to this person requires to be airlifted to Mulago Hospital immediately because we're not going to waste time with the Mitiana Hospital. This is too serious. That helicopter they are now going to buy, don't worry, don't tell them, but we're going to get it. And we shall use that helicopter to fly that person from Wabigaro to Mulago Hospital. By the way, we will have to have a landing pad for the helicopter, medical helicopters at Mulago. Oh, yeah, let them buy. I don't care how many helicopters they are going to buy. Let them buy them. We're going to get them, and we're going to use them as medical airlifting helicopters for our Ugandans who get sick. And if they have more than one, oh, we're going to distribute them by region. One will be serving the
mm.
northern region, one will be serving the Buganda region, another one will be serving eastern region.
It makes sense to repurpose them like that. As we move on to our next, so I want us to get into this referral hospital, what that is, and what that would mean for every federal state. As here it states, each federal state must have at least one fully equipped and well staffed referral hospital. The number of referral hospitals in each state shall be determined based upon the need and population density. For example, the need in Bunyoro State may require one such a hospital in Hoima and another one in Masindi. Acholi State could decide to have one in Gulu, Padar, Amuru, and Kitgum. So if you could please, Senior, explain to our audience today how this why is it important to base this off of need and population density? Why does population density become such an important determining factor of where to place these referral hospitals? As we will see later on, that also in Cuba's model, they did follow population density in order to place health centers around, which I think is also the direct comparison with what we're calling here a referral hospital.
Yes, that's a
And how
very
does
good
it make
point.
states?
Referral hospitals, as we are mentioning in this suggestion, is the
Mm,
population density is very critical and the distance. For example,
mm,
if you let's start with the distance. If you look at the
mm,
distance between Hoima and Masindi,
mm,
makes it imperative that people should not be taxed with going long journeys in order to reach a very important facility for that particular case. Two, the
mm,
population density is important. In some locations, you're going to find that there is a very sparse population density. Now, if you
mm,
put so much investment in a very, very complicated and a sophisticated hospital, they may have, uh, they may get 10, 20 patients in a week. But if you have a very big density population, that hospital is going to be kept busy. Or in some cases, they are going to say, we cannot handle the cases coming to our location. So population density is very important. Distance is important. Each state, as we say, look at Acholi. The locations we have mentioned here, if you look at the map, they are very far apart from each other. So it wouldn't
Okay.
make sense to have one referral hospital in the entire Acholi and put it
Mm.
in Guru. How about the people in Kitgum? It's so far away from them. How about the people in what is the other name of
Ada,
Padel,
Ada.
Amu? The distance is just prohibitive. So
Mm,
now, what are we talking about when we say referral hospital?
mm,
A referral hospital should have services above and beyond what a general hospital can offer. And I can think of such cases like open heart surgery.
mm,
We should have those kind of facilities in the referral hospitals. Another
mm,
special complicated service which may be needed in the referral hospital is eye surgery. Operating on eyes is not a simple case. It's not like operating or treating someone with malaria or a tumor in you know
mm,
on the neck or somewhere. But
mm,
these kind of facilities have to be provided. First, we have to train some
mm,
Ugandans to handle that kind of service. Two, we have to
mm,
provide them the necessary equipment to do these kind of services. I met a Kenyan doctor in Nairobi. He trained in Milwaukee, Wisconsin. And when he went back, he wanted to establish an open heart surgery during the days of President Moi. But the Ministry of Health complicated things that they could not provide him with the necessary funding to buy the necessary machinery to set up
mm,
a special clinic for open heart surgery. He had to go all the way to the president's office. And I had dinner in his house in Karen. And he told me, I'm telling you about what I have seen personally. I don't talk about things that I've only read. And he said, I went to Moi and begged him. And then
mm,
Moi had to put his foot down. But the people in the ministry were making it difficult for him to
mm,
get the funding and the machinery needed to set up an open heart surgery clinic. It's not the regular clinic where they are going to amputate my leg if it was sick. No, it's a special clinic, special equipment, and especially trained doctors to handle that.
mm,
This is what we are talking about. And that
mm,
referral hospital, those kind of cases don't come regularly, but when they do come from the general hospitals or dispensaries, we send
mm,
them over to the referral hospitals. And when we do send them to referral hospitals, there should be no problem in transporting the patient, delivering that patient to these places. And I don't want to see someone being put on a wheelbarrow from some remote places of Acholi on a wheelbarrow, taking that person to Guru Referral
mm.
Hospital or Referral Hospital. No.
Senior, I like this because it's the reverse of what gets done in many places. You usually find that areas of high specialization, you're going to find such high specialization like eye surgery or open heart surgery or even neurosurgery in general hospitals. But I like this reverse that people would then be recommended to go back to their area of residence or state of residence, so it gives ease and it gives the family also ease. For example, if I had to go through open heart surgery, I would be within my area of residence. My family doesn't have to travel so far out to a general hospital all the time. So I like this reverse of serving the community, and it also helps just provide more training for specialization, high specialization, and to have people who can do that from across all states and across different regions, even within the state. So, as you were talking, this in it of itself, whilst building policy, is something good to have in the foundation. The referral hospital gives a lot of strength to the healthcare system as a whole, and it's hard for it now to fall apart because we all don't have to depend on a general hospital. So I'd like
That's
the producer.
that is
No, sorry.
true. And also, they don't have to fly that person to Nairobi or to
Mm,
London or to
London
America,
or
because
Germany, yeah.
that specialization is available in Kitgum, is available in Hoima, is available in Masaka, is available
Mm,
in Jinja, is available in Mbale. Okay?
yeah.
And we can do it. All we need is
Mm,
to say, yes, we can. Yes, we can.
mhm. That is definitely true. So these ones are a bit thinned out. If the producer could please put them on. Yeah, but here, senior, if you could please go through this for us. So these are some of the basic facilities that would have to be found in a referral hospital. I like that the referral hospital in it of itself is built to serve a very particular purpose in terms of healthcare. And so some of them are an emergency service department, maternity service, surgery or operating rooms, prenatal and pediatric departments, intensive care units, adequate and well furnished hospitalized wards, dental department, eyes and ear specialists, any other needed specialist departments, and also public health and sanitation departments. So, senior, if
Yes.
there is any that you would like to go over in order for people to really, for us, all of us who are, listening and watching and I presenting, to wrap our heads around what makes a referral hospital so different from any other regular hospital and how it will serve specifically to a certain purpose within all these different regions once someone is referred there.
Well, every hospital, referral or
Mm,
regional general hospital, will have to have
mm,
emergency service. That's the standard. Maternity
yeah.
service is the standard. Surgery
Mm-hmm,
or operating room is the standard. Prenatal and the pediatric department is standard. Intensive
mm-hmm,
care, yes, it is standard. However,
mm-hmm,
when we come to general hospitals, intensive care is going to be determined by what kind of predicament the patient is in. Yeah, you
mm-hmm.
know, there is going to be a difference between a general hospital and a referral hospital when it comes to intensive care. All right, adequate and well furnished hospital wards. Now, you've heard of people telling you that yes, we would really want to admit this person, but we do not have any bed available. In other words, if they will not be able to kick that person out or tell them to go away, they will put them on the floor or on the veranda, as we have seen in Mulago and many other hospitals in Uganda. People sleeping on floors. Hell no. After NRM, hell no. That ain't going to happen after NRM is gone. No patient should be put to sleep on the floor or on the veranda. There must be fully furnished, fully furnished hospitalization wards with beds, mattresses, blankets, toilets, you name it, and
Mm,
even a chair in which your relative or your husband or your wife or your son or daughter could come and keep watch like they do in other advanced countries, so that we have everything that can make sure that can help us restore your health. But putting this sick person on the floor or on the veranda is trying to accelerate that person's ability to die. That's not what
mm,
we are trying to do. Not in the new Uganda. Okay,
mm,
we have talked about the dental department. Yes,
mm,
these referral hospitals should have modern or um, up to the standard dental department. Dental problems in our country have been ignored. Seriously. We want to see that there is a dental department, eyes and ears. How many people you've seen who really need eye treatment and they can't go to the Callisis or dispensary and get this done? No, it can't be done in those kind of places. And we are going to have our people train in these kind of specialized services, and they will be stationed in all these different hospitals. Now, another one is we are saying any other needed specialized department that is wide open.
mm,
Could be bone specialist, could be whatever that is needed. We're going to do it. Now, how there is another important thing: public health and the sanitation department. Public health
mm,
is a very, very important field. It
mhm,
is uh, it will prevent people falling sick unnecessarily because we must have people who are well trained, and these will be definitely extension kind of workers. They are the ones who are going out in the field, in the schools, teaching people basic health techniques and health standards so that they can prevent them from falling sick. And by the way,
mm,
public health people can also get involved in making sure that there is no stagnant water in which uh, what do you call mosquitoes can find a nice
question.
bedroom and reproduce and spread malaria. I mean, these things are preventable. If we
Mm,
had active public health workers going from village to village, teaching kids in schools, visiting clubs of women, we talk about clubs. We can have women's clubs, we can have church groups, we can have Gomborola community groups. These public health workers can be visiting them, teaching them some basic things. I visited a cousin of
mm,
mine when I was in Uganda, and I saw a kid who was dying of malnutrition. That kid was what you would call kwashako. The hair had turned brown like sorghum. The little belly was as if this kid had swallowed a football. The legs looked like pencils or pens and was sitting there on the mat. And I told my cousin, do you have beans? Cook the beans, smash them, and spoon feed this kid because this kid was lacking protein. I went
mm,
back less than a month later. The kid's hair had turned black like mine. Well, mine has some gray hair in it anyway. But
mm,
and the little football sitting in that kid's belly had shrunk a little bit, and the little legs had gained some strength, and the kid could stand up and walk.
mm,
You see? Now, this is the work which should have been done by some public health worker who would be visiting homes and villages like that. So that's what we are talking about. And there are many of our people we can train. And that doesn't take much training, by the way. We can train
mm,
them, give them the facilities to go around villages, inspecting these homes and telling people what to do. And we wouldn't have any problem of, children dying before the age of 5. And you look at these pharaohs, you know, now dancing, challenge, and they enjoying a good life and buying helicopters for whoever, spending money on military, donating money to Tanzania. Did you hear that? donated money to an orphanage in Tanzania, UPDF, building schools. You've seen Museveni build schools in Tanzania. All this money from Uganda is being wasted when it should be financing this kind of public health workers going around different counties and the villages in the country.
mm,
That's what we are going to change. And we are going to change it whether they like it or not. Under the federal system we are proposing, oh my goodness, you wait, you ain't seen nothing yet. And whoever might be thinking that it's not a good idea is going to be laughing all the way to the bank when he sees the benefits coming out of it. Because nobody will, you know, people will dance. And I can assure you, get some beer ready for their drinking because they are going to dance. We're going to change these things.
And this senior brings me to my next question. You did mention earlier on that the intensive care units that will be had in general hospitals will be a little bit different from the ones had in referral hospitals. So, what would this main distinction be?
Well, there is what we would call intensive care in all hospitals around here. Okay?
Mm,
But there are
yeah.
special cases which are
Mm,
much more serious that have to be taken from this hospital to the referral hospital. For let I don't think many people know where I am, but we have about 7 hospitals within where I am here in Washington metropolitan area. But I've had
mm,
and I've seen many cases whereby they fly these people by helicopter and say, oh, Holy Cross
mm,
Hospital cannot handle. Holy Cross Hospital is about a mile and a half away from my house.
mm,
Or they cannot handle this. Or what is it? Howard University Hospital cannot handle this. This person has been flown to John Hopkins University Hospital in Baltimore, which is 30 miles
mm,
away. And they take them, by the way, by helicopter
mm,
because they don't, those kind of special cases are not taken in an ambulance. They fly
mm,
them by helicopter. And over there on the roof of the hospital, they have a landing pad. Bam! They will drop the person in there. And um, John Hopkins University Hospital, by the way, is a very, very
yeah.
sophisticated hospital. Even some Ugandan doctors have been brought there to train them in specialized services, namely public health and other intensive care services. So
Mm,
you can see that the other general hospitals we have around here, like the Adventist Hospital, which is another 2 miles away from me, uh, uh, Holy Cross Hospital, they are general hospitals, by the way.
mm,
And they will do surgery, they will do anything. But special or complicated cases will be flown to Baltimore, John
mm.
Hopkins University Hospital.
Yeah, I
Even
think
in
so.
we have
Mm,
medical center. I think they call it the Washington Medical Center. It is also one of those which they have all the other services we have talked about. But when it is a
mm,
complicated case, that's where they send them.
mm. I think now that you were talking about it, it helped me also remember here there is a specialized, even here we do have a specialized children's emergency hospital. In case you're in a car accident with your child, you'll be sent to a different hospital and the child is airlifted to a specific hospital to handle children's emergencies. So I
Yeah.
think I'm starting.
Now, when
I'm
you
starting.
bring in the issue of children's hospital, that's a different line. We have
Mm-hmm,
specialized children's hospital even here
mm-hmm,
it's a specialized hospital, doesn't deal with adults. No woman is going to
yeah,
go there and deliver a baby, no. But when children are very sick, I will tell
mm,
you, one of our fellow Ugandan
mm,
had twins, and those twins some years ago, they had some serious health problem.
mm,
They were taken to children's hospital. The other
mm,
general hospitals could not deal with this. They took those
mm,
kids to that special hospital. They, I think they stayed there for a little over a month, and they were
mm,
treated and recovered. They are now adult kids.
mm,
They are over 20 years old. So that specialized children's hospital is very special, and they deal in nothing but children.
mm,
They don't treat adults. But in Uganda, I didn't bring that up because it requires very, very specialized training. And I
mm,
don't, but in due time, we shall reach that
yeah,
stage of building
mm,
specialized hospitals for children. And I
mm,
think that even here, they are not in many locations. There is one here in Washington,
true,
D.C., and there is another one in Philadelphia. Now, you see the
mm,
distance. Philadelphia, I know Philadelphia by train is
yeah,
two and a half, two and a half, yeah, 2.5 hours away by train.
mm,
So you can see the distance. They are not found in every location. No, those are special.
mm. Yeah, but going back to what we were saying with specialized intensive care units for referral hospitals, it makes sense because over time you'll even find hospitals that are better at certain intensive care things than others, where you can have people being sent to specific ones to deal with a specific problem in a given point at a given point of time. So it makes sense for referral hospitals to be like that. And it's true to have a specialized hospital for children. This has to come over time after we get at least even exposure to having a referral hospital beyond a general hospital. So with
Um,
that being said,
Desire, Desire, let
mm,
me throw in something for our viewers from West Nile. Some years
yeah,
ago, a
mm,
West Nile couple was
mm,
brought to John Hopkins Hospital, which I referred to as a special high,
mm.
not high class, but
They're high
highly
research.
specialized,
Yeah.
highly specialized service. This
Mm,
couple came with the kids, two kids who were born jointed,
mm,
and they had to split them.
mm,
Actually, I worked there on that case because they hired me to go and help the patient, the parents, the husband and the wife. Some group or organization paid for their trip to America, and they had to
mm,
bring them to John Hopkins University Hospital. And those doctors were special. They split those kids
mm.
who were born joined like this. They had their heads were separate, but the rest of the body was, and they
Was together.
split them. They split them, and they both survived. I
Mm,
saw that with my own eyes. And those kids, that family came from West Nile.
mm. So it is possible to be able to have these facilities in our own backyards instead of having to travel miles and miles.
Absolutely, absolutely. We can have that in Uganda. Well, if they are as they were in West Nile, we could probably have that kind of facility
Mm,
in the Iganga or in
mm,
the Ulu or in my home area, Masaka. That's where we have
mm,
this special hospital with this kind of
mm,
services. They should have brought them. They didn't even need to have a visa to come to Masaka or to go to
mm.
Iganga for that
Go to
matter.
Uganda.
Yeah.
Yeah. So I'd like to ask the producer to go on our next slide. And so here we're going to start to look a little bit at the situation that they have in Cuba, whereby in Cuba they have made sure that they have organized their healthcare system in order for it to be free. It is free and it is high quality. That's the best part about it. It's not free and poor quality healthcare, but it's free, high quality healthcare. Because it reminds me in Uganda, there is healthcare if you have a card, there's whereby they tell you you can access it for almost free, but it is poor quality. So we want a system where we can get free and high quality healthcare. So if a producer could please go to the next slide, we'll try to see what this means and some of the principles that they have actually followed as a nation. Because I also must say this, that in order for Cuba to have the healthcare system that they have today, it was after the revolution. They had what they termed a socialist revolution, and from that came this healthcare system. So it's not something that's going to fall into our laps. It's something that we have to work towards, fight towards, and then uh, put it in place ourselves as after a sort of revolution that we go through. So in Cuba, some of the principles towards the people serving healthcare system, healthcare is a right. These are some of the principles they follow. It's a right and it's available to all equally and free of charge. Healthcare is the responsibility of the state. This is a duty and a service that the state makes sure to give to its people. Preventative and curative services are integrated into this. It's not about only providing healthcare to treat, but also to prevent and also to be able to predict what might come, what might be a doom to the system. And also, the public participates in the healthcare system's development and functioning. The public is a part of it. They look at what the public needs and they fill in those gaps. Healthcare activities are integrated with economic and social development. In order for our nation to advance economically and socially, you need a healthy population. So that's why in Cuba they made sure that healthcare activities were integrated into this as well. And then global health cooperation is a fundamental obligation of the healthcare system and its professionals. And a good example of this is that Cuba, in so many occasions, has provided its services in terms of healthcare to the whole world, be it when there was a calamity, for example, with the Hurricane Katrina, a lot of professionals from Cuba flew over to the US to be of help, be it even with what we had right now with Corona. They always open up their services. One of Cuba's biggest exportation is doctors and healthcare knowledge. So they have managed to make that into one of their greatest exports, be it as a tourist attraction or be it as just doctors that they can send. But where does all this relate to us? I would also like to forward this question to Senior Chintu, whereby this becomes very important to us as well, because this is a product of a revolution. This is a product of wanting to change the system inside out. It's not us waking up and wanting to write a policy to change our healthcare system where we can easily do it and have that, but it has to be a product of the experiences that we're facing now as of today and where we want our healthcare system to be. So if the producer could please go on to the next slide. So these are some of the steps that they took towards universal healthcare. There was a reduction in prices of medicine. So the government subsidized medicine with the pharmaceutical companies. There was nationalization of private healthcare facilities. So clinics and pharmaceutical companies, some of them were nationalized. And then there was centralization at the Ministry of Health, with the decentralized regions and districts. And we will go into this one further as we look into the presentation. But this works for us, especially with federal Uganda, because we have a centralized government and then we have its decentralization at the level of states. So in Cuba, what they did, they do have at the ministry, they have it centralized, but everything is set up in different regions. And this is how they had a centralized healthcare system that is also decentralized across regions and districts. And the the principle of planning the population needs. They always plan what the population needs in terms of health. Therefore, this facilitates for how many doctors. This is what Senior Chitu has also been talking about. Then we can start looking at how many specialized doctors we need to train in terms of eye care. How many specialized dentists do we need to train to distribute across referral hospitals? So we start to plan for different populations and where the referral hospitals are based off of the information that we have. So there is a principle to planning what the population needs. That's why population density that Senior Chintu was talking about becomes very important towards planning for the nation. And healthcare personnel, how many of them for public health do we need per state? How many do we need within every different radius to make sure that certain preventative measures are taken in communities and are talked about in communities on a daily, and to report back, give reports, and in order for us to see how we're progressing in regards to that. Then also something else that they did was to provide for the learning and expansion of herbal and indigenous healthcare practices. This is because Cuba is an island of imported population, and also the mixture of indigenous and when the colonizers did come over. So there is a lot of African peoples who were put there, and there is a lot of indigenous knowledge in Cuba. So what they did, they made sure that they did not only stick to what Western pharmaceuticals were doing or had been doing in their land, they integrated the indigenous and herbal healthcare practices. So planning of preventative and curative healthcare system, we've already talked about that. And what they did was the privatization of medical care practice was prohibited by law. So there is no private hospitals in Cuba. They are all owned by the state, which means healthcare is free for everyone. So all hospitals are under the state and provide free healthcare for the people. But what I know is pharmaceutical companies are unionized and some of those are private. But when it comes to the hospital, the physical hospitals, privatization is prohibited by the law. And if I can throw in before I invite Senior Chiti to come and give us how this compares to what we want to do in Uganda. For example, Cuba is known for its cigars. A lot of Cubans smoke cigars to the point that when even Cuban fighters were in African regions, helping during the struggle of independence, one of the ways that people found out there was Cubans in the area was when they saw people smoking cigars. So that being said, because Cuba, the country knows they do have a large part of their population smoking cigars, Cuba is the first country to ever come up with a vaccine for lung cancer. So that is a huge medical advancement that we haven't seen anywhere else yet. A vaccine for a cancer. So Cuba as a population, the nation knows they smoke a lot of cigars, so the healthcare system provided for a way to have preventative measures towards a calamity that they know most of their population is headed towards, which is lung cancer. So they have managed to make a vaccine against lung cancer. And this is out of a leisure activity that they do as a nation. So, Senior Chitu, this example, I find that Cuba gives a lot of pointers to a lot of third world countries, especially because let's say Cuba is poor. It's considered a third world country, but its healthcare system has managed to provide for its population thoroughly and consistently. So it gives a lot of pointers for us to start looking at where things actually do work and serve for free. So if we could please expand on this and how this uh, fits in within also the picture we're trying to view for ourselves.
Yeah, that's a very good experience. The Cuba experience is very unique and very important for us to study closely. I would recommend that after the NRM goons have left our land, we should take a closer look at the Cuba experience and see what is relevant and what can be copied and what may not be copied. Because every system or every country is going to design its system according to what they need, the culture
mm,
of the people, the facilities they have access to, etc., etc. However, there is one thing that I would not hesitate to copy from the Cubans, and that is high quality and free medical services. Now, I want to underline the word high quality. High quality includes medical ethics. A Cuban doctor is not going to dilute the medicine that is going to put in the syringe to give you an injection. A
mm,
Ugandan medical officer today might put water in that syringe and pretends that he's giving you an injection that will cure you. There is a total erosion of medical
mm,
ethics in Uganda. That has to be rebuilt. You are not going to get high quality medical services when you have
mm,
these medical practitioners, be it doctors or nurses, that are crooks par excellence. You are not going to get high quality service. They are
mm,
stealing the drugs from the hospital, turn them at night, put them in their private clinics and all stores, and they will tell you that uh, or if you need to be treated in this kind of problem, we we can advise you go down to Hobart Street, and there is a Duka there which will sell you these drugs. I think some of you may have seen a documentary. I don't remember who made it. Some international organization. It was on the news. People stealing medical supplies being sent to different locations, turn around and they sell them to Congo or to Southern Sudan to make money for themselves. They caught some bastard in Guru who was doing that. And he had a racketeering support from the police officer of Guru. He had some other people working with him. They were also sharing the spoils of siphoning off these drugs, selling them to Southern Sudan, while the people in Guru are dying. But the medicine had been donated to Uganda by USAID and some other international agency. You know, this has to be fought. And by the way, the punishment for this, you don't have to ask me what punishment should be given to this kind of people because they are killing our Ugandan citizens. I think they should pay with their own lives as well. We must fight this collapse of medical ethics in our hospitals. It has to be fought. It has to be fought as much as we are fighting the Batus to get out of our country. It has to be. Having said that, then I turn to the issue of training. Yes, when you look at Cuba, they have done excellent training of their people. We must do the same. We have so many Ugandans who are looking for jobs. We have so many Ugandans who can be trained. And by the way, one of the things I've heard that is going on in Uganda, kids who get admitted to Makerere University or some other schools, a kid could probably say, I want to study medicine. And the bosses there tell him or her, no, you are not going to go to medical school. We want you to go study history. And they force the kid to go and study what that kid didn't want. That must stop. We have to let it open so that our kids can go into these institutions of higher learning, specialized learning, and they say, I want to study this. And then we let them study, train, and they get good education. Then they come out and they will serve in our hospitals. I have heard of many students who were diverted from sciences to some, maybe even studying, what do you call it? Dance, drama, and music, whatever, MDD. I mean, it's ridiculous. Now, when we talk about medical ethics, I'll give you one example. And this happened, by the way, to my former classmate called Emmanuel Pinto. He used to be with Museveni during the first days of Museveni. Emmanuel Pinto's son got in a car accident, and the people with whom that boy was took that boy to Mulago Hospital. And the medical officers there or medical personnel there just ignored the kid. And then Pinto gets a message. He was living at Muyenga that your son has been in a car accident, has been taken to Mulago Hospital. Pinto got in his car, drove to Mulago Hospital, and found the boy lying there by the door, and asked, by then I think he was Deputy Minister of Internal Affairs with Museveni, screamed and said, how come nobody has taken care of this boy? And you know what those nurses or medical assistant or whatever their ranks are? Oh, we saw some people brought him and put him there, but we didn't know what was wrong with him. The boy was bleeding, and he bled to death. And the reason is nobody brought this kid and said, by the way, if I give you 10,000, would you please take care of him? They were waiting for someone to give them a bribe so that they can even lift him from the veranda near the door. And the boy bleeded to death. And the Pinto left that place pissed off like hell. And what I'm telling you, he told it to me. It's not that I read it in the papers. He told it to me when he came to America because his other son was graduating from a medical school here at Howard University Medical School. Now you can see how many parents have experienced this kind of stuff because nobody came with a bag and they bribed the nurse or whoever so that the bleeding person can be dragged into the hospital and be bandaged, be bandaged over the wounds or whatever. It's ridiculous. So we cannot talk about high quality when we have no medical ethics. Now, training is very important. We have to train our people and enforce medical ethics. You are in this field to serve the public. Two, we have to put a lot of emphasis in manufacturing drugs. As you all know, all the drugs are made out of plants or some other material which can be grown in our country. And by the way, we have unlimited sources of medicine that can be extracted from plants, including mushrooms. We have to emphasize research and development and produce our own drugs. How come we can't even produce drugs to cure malaria, which is our, if the Cubans can find a vaccine for their smoking cigars, why don't we find a vaccine for our malaria, which is our biggest problem? I mean, it's a matter of putting your mindset on something that can serve you and your people than simply dancing all night long. This is what we need to do. Instead of wasting money and brains and resources in stupid things, including buying a helicopter for some widow to go and look at the cows, why don't you bring the damn cows to her house? Besides, she has a very big house anyway, and her husband is gone. So there is room in her bedroom for 3 cows, whatever they want. I mean, it's ridiculous. It's a question of changing the mindset and concentrate on serving. And I'm saying the word serving in capital letters. That is what is missing in our country. And that is what the federal system is going to bring. Because once you put everything back to the people, then the people are going to look at it as their own. They own it.
mm,
And then they are going to demand that this should be expanded, this should be provided, this should be done this way. And every, the end result is yes, let's do it. Because yes, we can.
yeah. And that, if I could please ask the producer to go on to the next slide. So, Senior, we're going to look a little bit specifically into what this idea that Cuba did, which I think will also work for us. We have the stance to do that, especially with the federal state. So, what they did is they centralized it and then they also then decentralized it. So, they have medical institutes whereby those are at the highest point, and then they have hospitals in regions, and those are regionalized, and then they have what they call community polyclinics. So the polyclinics, these are within communities. So this is where they start to look at specific communities and population densities. But in order to get those communities, what they did is they started what they call a family doctor and nurse team. So every family in Cuba has a doctor. No, every family has a family doctor. So for example, every family doctor might have 20 families. So that in itself then becomes a community of sorts. So for example, five family doctors can form a community, and in that community they then put what we call a polyclinic. And then on the regional basis, there is the hospital, and then the medical institute come in on the state basis. They have managed to break a break to what's the word for it in English? To proportionize, I think, their healthcare system in order to have it centralized but yet decentralized. And I think for us, we have a great opportunity with the federal system because we have the states and then we have the centralized state that brings together all these different states. So here they give an example. At the basis of it, you have at least one community having about 1,500 individuals, which is roughly about 375. So that community will be served by a polyclinic. And then, if that polyclinic is not servicing what they need, and keep in mind, every family in that region has a family doctor who, the first point of service in Cuba is a family doctor coming to serve you at your home. If you can't be served at your home by this family doctor, then you can move on to the polyclinic. And if the polyclinic's not working, that's when they refer you to a hospital. And then the medical institutions just serve the whole system as a whole. So this in itself also gives us an example of where we can start to see where the referral hospital sits in. But I wanted to ask you, Senior Chintu, because this becomes very important for us. When we first were talking about this program, you think about it, for example, how every state and within every state you'll have different zones and different communities in within a state. Would having a family doctor for different communities serve as to a benefit? Because what I found very interesting is that what they did is not everyone needs to come. You don't always have to come to a hospital. For example, every time I got sick in Uganda, I would go to the clinic, a clinic nearby, and it was always malaria or typhoid from when they bring the results in. But I think my question here is they've managed to reduce the number of clinics all over the place by placing a family doctor in every community where you don't have to come to the doctors, but the doctor will come for you at your home. And then, if your case is big and you need immediate healthcare, then they take you to the community polyclinic. Then I think for us in that case would be if that doesn't work, then you go to a referral hospital. So I wanted to ask you in regards to this, if this is how would we work? in within Uganda's model, how would we work it from the ground up? Do you directly get taken? Do you primarily go to a general hospital and then maybe from there you get referred to a referral hospital, or are there community clinics that we first go into before going to the higher stage?
That's a good question. Now, we have to
Mm,
remember that every society designs a
mm,
system that fits within their cultural, social, and economic setup. The cultural, economic, social, and the political setup of Cuba is definitely
mm,
going to be different from ours. Ours, when we talk about the federal system and the
mm,
national federal government, the federal
mm,
state will have a medical service department, which
mm,
does what I would call hands on management
mm,
and administration of the medical services within their federal state.
mm,
Above them is going to be the national federal government, which
mm,
handles policy and the direction and the supervision of making sure that there is what you call quality, high quality medical services, which are free in the entire country, regardless of the economic, social, educational, or whatever differences. That's the way it
mm,
should be. Now, in the case of Uganda,
mm,
if I start at the bottom, you would have dispensaries
mm.
in different locations.
That's true. I saw the
You may,
dispensaries.
the dispensaries will be at the bottom. It may not
Mm,
be easy to have some kind of special clinics whereby you have a team of doctors who are assigned to each family. It may not be possible in Uganda, but you would have a
mm,
clinic on the village. A few villages would have a clinic whereby people can easily go when they have some simple problems. And then on top of the clinic, you have the dispensaries.
mm,
Dispensaries, above the dispensaries, you have what you would call regional hospitals. Regional
mm,
hospitals, they would be full hospitals with emergency room, maternity, you name it.
mm,
And above the regional hospitals is where you have the referral hospitals. Okay? Now,
mm,
the when I look at the design for regional hospitals, they would be full hospitals located in specific distances. And also, of course, you have to look at the population density. And I have used
mm,
my knowledge of my home district of Masaka
mm,
and figured that we would have a regional hospital at Kalisizo, at Chotera, at Rakai, at Kakuto, Kalungu, Liantonde, Lukaya, Buyoga, and Sembabule. Now, when you look at
mm,
those areas, they have a lot of people there. And the distance is self explanatory. You could do
mm,
exactly the same thing in every area, like in Iteso,
mm,
Soga, in Bugishu, in Sebei, in Bunyoro, in Toro, and see how far each place is and have a regional hospital. Then you would have dispensaries in other locations. Again, I'm using my experience of Masaka, where I come from. If you look at where Narozari is, there should be a facility there for a dispensary. And as you said, in most cases, you're going to find that people who come to the dispensary, they are talking about malaria or typhoid. Those are the
mm,
general problems. We are not talking about eye surgery there. When it is a case of eye surgery or dental problem, then you have to fly that person or get an ambulance to a regional hospital a little far away. If it is a snake bite, the dispensary can take care of that. Then I look at
mm,
distances like Narozali, Kannabulemu, Byakabanda, Matete, Ntuusi, Bukomansimbi, Kyamuliibwa, Bukakata. You know, you can see the distances if for those who are familiar with this area, you can see the distances are very well taken care of, and the people in those areas are taken care of. Now, as
mm,
I said, most of the small dispensaries, it is going to be basically simple things like malaria, typhoid, snake bite, or some
mm,
kids jumping out of a tree where they were picking mangoes and broke his legs or broke his arm. You know, if it is a serious damage, the dispensary is going to say, let's call the ambulance, take him or her to the regional hospital for that kind of treatment. Okay? Or now, another thing these dispensaries and the clinics at the lower level can do is a pregnant woman needs to be checked periodically, needs to
yeah,
be advised what to do so that the pregnancy cannot become a complicated matter down the road.
mm,
You know, I remember, I don't know what they call it. When I was growing up, we had a dispensary at Vikira, and the women used to go there and they used to call it kirongosa. They used to give them these big bottles. But I learned much later that what they were giving these pregnant women was some kind of vitamins because they were lacking in their diet. So they would go to the dispensary. And I remember my sister-in-laws used to go there too and get those big bottles of some liquid and said, "Oh, we got it." They call it kirongosa. It is supposed to clean and so that the baby can grow, you know, in the very nicely, no problem when the time for birth comes. But I think they were the nurses there. I remember the nurse was a German woman. She
mm,
noticed that these women were lacking protein and the necessary vitamins. So
mm,
these liquids in a big bottle were to supplement what the deficiency of vitamins and whatever. So this is what we are looking at. The, we may not be able to do it like the doctors in Cuba do it. Even in England, I understand they have family doctors. But you
mm,
see, it is easy when you are dealing about urbanized community like London. But when you have
mm,
rural communities like ours in
mm,
Uganda, where 80% of our population is in rural area, you are not going to
mm.
assign every families with a special doctor. It's impossible.
And
However,
I think,
you have to
yeah,
position these clinics whereby they can easily access
it's
them.
like them. Mm. And I think we're gonna look a little bit into further on down into what Cuba did with the whole rural urbanization because they also have a significant amount of their population that's in the rural areas, whereby it was about it's exactly what you just said now, Senior Chintu, making these facilities accessible for them in the rural areas. What they did
Yes.
was send doctors and set up clinics in the rural areas in order to have this access for people within the rural areas. But also, what I found very interesting, what you said just now, that relates back to some of the things that we covered on earlier on, earlier on when we were looking at ambulances, I wondered when you did say that now I understand why dispensaries need more ambulances than the regional or referral hospitals, because these are the ones that are in the community, so they need more ambulances just in case something tragic happens within the community to be able to drive them to a referral. So and I now understand the proportionalized distribution of ambulances in between a referral hospital and a dispensary. Because a dispensary is at the community level to cater for anything happening within that community, be it workers or people who stay in that community, so that they can then easily be taken to a referral hospital. And a referral hospital is rarely getting people directly into that referral hospital unless people stay within that region. But it makes now sense to me, I guess, why the dispensary needs more ambulances than a regional hospital. If that makes sense to members in our audience now, if they can see why that distribution was done that way, and I think it's something pretty neat. It's a neat way to utilize our resources to serve more people with fewer resources, because now we don't have to go and buy, because African leaders are usually wasteful and they will go and buy a fleet of 100 vehicles that they cannot distribute properly. So we're smarter with our resources. But with that being said, I'd like us to take a little break. We're halfway into our program, so we will take a small break and then we'll come back and attend the end of our program. The studio line is on the screen for members watching or audience members watching who would like to ask us questions, comments. Please feel free to then start sending those in to the studio number on the line. But right now, we're going to go on a short break and then we'll be back after the break.
Why do we need the federal system of governance in Uganda? And what is federalism? Federal is a system of governance. It's not about getting rid of the central government. It's not about party politics. It's not about multi-partisan or absence of it. It's not about religious differences. It's not about tribalism. It is not for the benefit of Buganda alone. It's not about monarchism. It's not about land or dispossessing people from land. It is not about supremacy of one region over another or others. It's about helping the central government to provide services more efficiently and provide more effective development to the people. It's about sharing power and responsibilities between the central government and regional governments. Federalism is about providing more prosperity, more wealth, more feeling of belonging and participation in governance by marginalized and non-marginalized people. The federal system of government minimizes possibilities of waging war against the central government. It minimizes internal acts of terrorism and discontent against the central government. Why do we need the federal system of governance? Why do we need the federal system of governance in Uganda? And what is federalism? Federal is a system of governance. It's not about getting rid of the central government. It's not about party politics. It's not about multi-partisan or absence of it. It's not about religious differences. It's not about tribalism. It is not for the benefit of Buganda alone. It's not about monarchism. It's not about land or dispossessing people from land. It is not about supremacy of one region over another or others. It's about helping the central government to provide services more efficiently and provide more effective development to the people. It's about sharing power and responsibilities between the central government and regional governments. Federalism is about providing more prosperity, more wealth, more feeling of belonging and participation in governance by marginalized and non-marginalized people. The federal system of government minimizes possibilities of waging war against the central government. It minimizes internal acts of terrorism and discontent against the central government. It has inbuilt safeguards that ensure uniform growth for all regions of the country, and additional measures to make sure that the marginalized or less developed regions of the country can catch up through the system of equalization grants and affirmative action programs. This ensures that the regions with greater income and development contribute a percentage of their earnings to the developed areas which may be less developed. It should be noted that federalism, though different from decentralization, does not contradict or exclude decentralization. The two systems can and should coexist and complement each other at the regional level. Advocating federal does not mean or seek to get rid of decentralization from regional tier. Nor does it mean getting rid of district MPs, LC leaders, or other regional government officials. To learn more about federalism, register and join UFCC at www.ufcc.uk.
Dr. Andrew Takome Kaira was born on 30th January 1945 in a small town known as Nkokonjeru in the Uganda region. He is regarded as one of Uganda's forgotten heroes, a true nationalist whose love for his country sent him to an early grave. He was a lawyer and professor and had many accomplishments since 1971, with many of his accolades attained from his education and political experiences, both nationally and internationally. Significant is his doctoral dissertation titled Condoism in Uganda, which has awarded him an internationally recognized terminology now used in criminology. He joined several political organizations, including Uganda Freedom Movement (UFM), which he was the leader, the Uganda National Liberation Front (UNLF), later joining the National Resistance Army (NRA), which had once been his organization's rival. Dr. Kaira is regarded as one of Uganda's forgotten heroes, a true nationalist whose love for his country led to his premature death. He was just 46 years old when he was assassinated on 6th March 1987 during a dinner with his close friends and 3 female acquaintances. His killers have never been brought to justice.
And welcome back from that break. You are on the tower at UNN, and today I'm with my co-host Senior Kintu, and we are discussing the rebuilding of our healthcare system in Uganda, how that could look like, what steps we can take towards life, and what to expect and how we expect it to deliver. So the studio line is still on the screen. If you feel you have any questions, comments towards today's program, as we now go towards a little bit towards the end of our program, feel free to start sending those questions in now. We will answer them right after this segment. So I would like to ask the producer to please go back to the PowerPoint slide. There's a few of the stuff that we have already talked about in this last segment, so we will just go through them as a refresher and then we will continue into the program. So Senior Chintu, you did talk about the regional general hospital, what that looks like, and the purposes of that. So here it states, in addition to the referral hospitals mentioned above, for each federal state, there should be additional general hospitals in each state that are strategically located in selected places according to the distances and the needs of the population. You gave us the example of in Masaka district, such hospitals could be at Kalisizo, Chotera, Rakai, Kakuto, Kalungu, Yantonde, Lukaya, Buyoga, Sembabule, like in such distance demarcations. Other parts of Uganda will also determine locations for such hospitals in different parts of their states, and this is dependent on population density and distance. And if we could go to the next slide, please. And you did talk about the dispensaries. And again, to use the example of Masaka, how dispensaries will be organized, they'll be in locations such as Narozali, Kana, Kanabulemu. I might be mispronouncing some of these places, but I will do my best. Byakabanda, Matete, Ntusi, Bukomansimbi, Chamulibwa, Bukakata can be served by dispensaries. And for people who are familiar with these locations, this would make sense. But I will ask Sini actually a clarifying question for people, for some of us who are not familiar with these locations. And then the bottom line is that the medical services must be available and easily accessible by all Ugandan citizens. So, Senior, in regards to the distances that are covered by the dispensaries versus the distances that are covered by the regional hospitals, dispensaries cover a shorter distance span and a smaller population density in comparison to the regional hospitals, which are covering a larger distance and a bigger population density distribution.
That's correct. These
Oh,
uh, these local dispensaries, they are covering
mm.
smaller but also isolated places. For example,
Oh, that's important.
Kanabulemu, if you
Mm,
look at the map of Uganda, Kanabulemu
mm,
is way out there in Sango Bay near Lake Victoria. There is a
mm,
distance between Kanabulemu and Kakuto.
mm,
If we have a regional hospital in Kakuto, that regional hospital takes care of that whole area from,
mm,
say, from Sanje all the way to the
mm,
Tanzanian border and
mm,
they were deep into the villages close to Byakabanda area, Byakabanda
mm,
County in Koki. And then you have Kanabulemu all the way down to the lake. However, if
mm,
there is a dispensary in Kanabulemu, simple cases can be dealt with at the local dispensary. If there is a
mm,
need to bring that person to Kakuto, we can use the ambulance and pick those people from Kanabulem, bring them to Kakuto. If there is a bigger problem, then we can use either this confiscated helicopter we're going to get from this Banyarwanda, or we can use an ambulance and take that person to Masaka. All right.
mm,
So when you look at the distances between the regional hospitals and the so-called dispensaries, you can see that medical services is readily available to anybody in between without too much of a distance. Now,
mm,
don't forget, we are going to have a federal system of government. These are
mm,
suggestions to give us an idea how things can be
mm,
designed. Under a
mm,
federal government, the federal government, members of that state, are going to sit down and figure out, because they would
mm,
have a medical department within the federal system as much as they would have an educational department, etc., etc. Now, the people in charge of medical department will be both medical uh, uh, policy makers and being assisted by some medical experts like professional physicians. And they can design according, they can make changes and design according to their needs and
mm,
also the availability of funds. Now, when I mentioned funds, if they really come up with a genuine proposition that they do not have the funds to build a general hospital at Kakuto and Chotera and Kalisizo, this is where the national federal government jumps in,
comes into
because the
place.
national federal government is committed to providing
Mm,
accessible, high quality medical service to the entire population. Now, if you people, let's say in Koki County, I mentioned Rakai here and the Biakabanda, if people in that area, the local government, the state government, does not have the capacity to build that hospital, the federal government jumps in, because we cannot afford to leave that entire count of Koki without medical service.
mm,
We cannot afford, and
mm,
yet we have the money on the national level. So the
mm,
federal government will. However, the designing the location, the the federal government is going to give the state government, we need to have medical services available to the people. You come
mm,
up with a proposition. Now, I can imagine the state government saying, no, 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 we shouldn't build one at Kalisizo. Let's have one at Kyotera, and then jump and go to Kakuto and eliminate Kalisizo. But they have to give us a reason why they're eliminating that place. Because when I look at the distance and the density population, really there is a need there. However, if they
mm,
decide they don't, okay. If they say we can omit a dispensary at Narozari, then they have to come up. How are you going to solve these local problems? They have to come up with a justifying reason which is acceptable. If it is not acceptable, if it's a question of money, the federal government jumps in. Okay?
mm,
However, the services have to be there. Now,
mm,
the federal state government is going to have hands-on participation in the design of locations where these hospitals, general hospitals, dispensaries, whatever, are going to be located. And then the federal government is going to be responsible for making sure that we are training our people to man these facilities.
mm. So,
I hope I
if
have
I could ask,
answered.
oh, yes, you
Okay,
have.
guys,
And there's something that you said that we're going to go a little bit into depth about because there's this notion of isolated. How do we serve our isolated regions? How do we start to serve? Because, for example, maybe for our audience members to understand, there's for example, the example that you gave was even a perfect one, a place that is all the way almost by the shores of Lake Victoria, or even if we talk about like Kalangala and all the other small islands within that region, how do we serve how do we serve them when how do we serve those places, and how do we set up a medical system that is going to serve them. So I just want to keep that at the back of our heads as we continue, because that is also one of the attributes of a good healthcare system that could serve everyone, one that's able to cover the blind spots. If the producer could please go to the next slide. So, yeah, it's exactly here on point. So, one thing that I found very interesting, what they also did, they made sure to have social and rural medical service. So, what they did, they started in Cuba, they started sending doctors to the most rural areas of the country, places whereby, because one thing about also some of our rural areas, it's very rare that you're going to find people from the rural areas coming at a frequent rate into the urban centers. Most of them stay there, if not for half a lifetime, for most of their lifetime. And if the producer could please go on to the next one, please. So this one, we talked about this one earlier on. It's the family doctor program that they have, where a doctor and a nurse team is in every neighborhood, and they did this to reduce like administrative costs and emergency room fees plus hospitalization. Every neighborhood has a family doctor to report to, and they have a detailed health record. There is also a well-trained team of nurses that help the doctor with administration in every community, and also this is done to help facilitate continuous assessment and risk prevention. We could go to the next one, please, as well. And they also, this is designed along what they call the health zones. So this is what Senior Chintu has also been talking about, whereby a federal state is able to sit down and decide and demarcate where each hospital, regional hospital, needs to be, or where they need a dispensary to be. So, and each under a polyclinic, in Cuba they call them polyclinics, which is a medical facility that is offering outpatient services. So the health zones have to be decided by the federal government, which Senior Chinto has just explained just now, where if a certain place it's not justifiable not to have a dispensary there, the state government can step in if the reason for that dispensary not being able to be placed there, or that regional clinic, and there is a need for it, the state can come and facilitate it financially if the federal state cannot cover it. So health zones will be decided by the federal government of that state, and they will draw out a plan to justify how they have chosen dispensaries and regional hospitals to serve every area that they are placed in, be it due to isolation or due to population density or be it due to distance. So they are able to justify that, and in places where they are not able to finance those facilities, then the state government comes in because of its dedication to the nation's healthcare system. If we could go to the next one as well, please. And this is also just another example of what they've done in Cuba with the neighborhood health committees. These ones work closely with local authorities and healthcare providers. They are partaking in the health needs and analysis of the neighborhood. So, this is what Senior Chintu was also talking about. An example would be the public healthcare service providers. These are the ones who come into communities and are trained to talk to communities about efforts that they can take, for example, towards clearing of stagnant water and why that is important. Uh, so, an organ through which people can air their complaints and about the healthcare system. It's also used as a feedback loop. And this committee also has the ability to call doctors and other health care workers to account and, if necessary, request their replacement. So, Senior Chain, too, this is one other thing that I found very interesting. So, we had discussed earlier on that another quality of one of the attributes of high quality healthcare system is the ethics. And in Cuba, they have found a way to have a feedback loop that is a third party, which is the neighborhood health committees. And I find that another comparison to it with Uganda and what has been proposed here is the public healthcare program. So these are people who are able to come into communities, talk to people about the services they're receiving, how it's working for them, how the doctors and all the regional polyclinics are working out for them. And on top of receiving that feedback, they are the same team that goes into places to advise people about why, sanitation is important, why they ought to clear stagnant water, and all these things of preventable diseases in communities and how they can be avoided. So I found this particular part very interesting of how we can implement the notion or the program of public health care, if that makes sense to a certain point.
Yeah, yes, actually, let me start with that portion.
Mm,
Keep in mind, we are talking about a federal system of government whereby the
mm-hmm,
people are directly involved in managing their
mm,
destiny. And there is no
mm,
shortcut to that. The people are
mm,
going to be directly involved in making sure that they are getting the best service for their money. After all, they
mm,
are the country and they own the country and they own the services and they want to make sure that they are getting the best for their money. Now,
mm,
when we out when we talk about medical ethics or
mm,
just simple professional ethics that you signed up to be a nurse or a doctor in this hospital in this country. I remember
mm,
one time I was talking to one physician here in America, and we were talking about someone that we really didn't like. And that person went to hospital. I said, God damn it, why don't you give that fool some extra pills so that he can clink out real fast? He said, doctors cannot do that because they swear to the oath that our profession calls to saving lives. Now, this
yeah.
guy has been killing people there in mass shooting, and the police came and they shot him, but he didn't die. And they take him to a hospital, and they are trying to save the fool. Let him die.
Mm,
I mean, that's the way I see it. But the doctors are not
mm,
supposed to do that. Even though he has just killed 50 people in a movie
mm,
theater, and the scarf of really, saving the people and grabbing the bastard, they shot him, but he
mm,
didn't die. The doctors are supposed to save him. You can imagine. I mean, anybody listening to me would say, we would wish that fool dead, but the doctors cannot say
mm,
that. Their job is to save lives. Medical
mm,
ethics calls for that, and a doctor will not compromise on it. Now, let's go back to the points you've raised. Outpatient service, it is very easy to do that in urban areas. We can
mm,
have an outpatient place in Indeba, another one in Katwe, another one in Natete, another one at Busega, another one at Bulenga, and Chengera, okay?
yeah.
Where people can simply go quickly and say, oh, doctor, whatever, or nurse who is working there, I could not sleep. I had a splitting headache. And
Mm,
the technician will measure your temperature, blah, 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 and figure out what did you eat? Have you been to the bathroom? No, I haven't even been to the bathroom for 2 days or 3 days. Okay. They'll give them some little pills to help them open their bowels, and they give them maybe a Tylenol to take care of the headache, and they go and drink a lot of water and lie down for a while. Okay, thank you very much. They go back to their house. Case closed. They don't have to go to the dispensary or the hospital. But that is easy to do it in urban areas. We could have those kind of services. Now, when it comes to having family doctors, or neighborhood clinics. Again, it is easy to think of those in urban areas. But in rural areas, it's different. Let
Mm,
me give you an example. When I was growing up, which is 100 years ago, by the way, we had um, a visit. This nun was a Muzungu nun working at Villa Maria Hospital. Those who know Masaka, that's where we had a hospital. But we had clinics at Bikira, at Matale, at Rwagurwe, and several and Chamaganda, you know, those scattered areas in Masaka. At Bikira, she used to come on Thursday, and people knew that. By the way, her name was Sister um, Kilik. I think that was her name, Kilik. But the Baganda called her Kiriko. It became a popular name. We are going to see Dr. Kiriko on Thursday because she came to Bikira on Thursdays, and she would come and take care of the health problems, take care of the pregnant women, give them some medicine, and the kids who are sneezing. We used to be having runny nose, and she would take care of all these little problems, which were very common, by the way, malaria, running nose, you name it. And she would take care of us on Thursday. Then another day she goes to another location, maybe Chamaganda, where Prince Chimbugwe comes from. And she would, people would probably be expecting her on Monday. And she was a visiting doctor. In remote areas, as you mentioned, these areas of different islands in Sese, Karangala, plus. I've never been to Sese, but I know there are several islands there with population. We cannot build a hospital there, but we could have a visiting person like that. When there are serious cases, they can be airlifted to the mainland and be taken care of. But a visiting person like Chiriko, whom we used to have in the 50s, that would make sense today. And I don't think we have that kind of service in Uganda today. I don't think so. But under the new federal system, we may have to revisit this idea. And if the people in charge of health services for this particular state of Teso, Bugishu, Busoga, you name it, if they say, well, we got these remote areas, they need to have this kind of service, it can be done. It's not a very complicated. All we need is a car and a personnel, a doctor with a nurse and some equipment and some regular supply of what is expected to be common illnesses in this area, like Tylenol, like malaria medicine, like penicillin for which diseases that is. I mean, it can be done.
that that makes even so much sense where we have strategized and regrouped our, because it's so that we can use, because our resources are going to stand out. eh, I'll call them expanding resources, because right now we have to put our small resources to use, but also be able to use them in a way where they can expand over time and serve the need as time goes on. So going on to the next slide, if the producer could please go on to the next slide. This was also a very other interesting one, and this one is this slide covers pharmaceutical and medical production distribution. This is an example that is taken from Cuba. So what they did there, and they unionization of the medicine making companies. So pharmaceuticals and all those industries that were making medicine within the country, those were unionized. Providing of the making needed raw materials that was taken care of by the local market itself. Then the government made sure to subsidize medicine to the people. So seeing the doctor is for free, but when you also go to buy the medicine that you need, it's subsidized. So it's at a reduced price rate than the market value. and then interaction between, as I said earlier, herbal medicine and Western medicine practices, and there was as well a lot of effort put towards training of more professionals at every state level. So, uh, senior, because this is also another question. There's the healthcare system where you have the doctors, the surgeries getting taken care of, but there's this one thing that goes into the healthcare system, which is medicine and the pharmaceuticals. And pharmaceutical companies is one of the things that has made healthcare so inaccessible, unattainable, and very expensive for us as a nation, especially given the fact that we do not make most of our medicine. Most of our medicine comes from abroad, and as we know, there is so many rules that are governing internationally the sale of drugs. Like a very interesting example for me with Uganda was when we were in the HIV crisis, whereby we could not buy our drugs from the US at that point in time because it was very expensive. So we decided to buy our drugs from India, which was a lot more cheaper for us as a nation to attain. But by the time the drugs reached Entebbe Airport, because of international laws, we were not allowed to buy from India. These drugs had to be shipped back, but also then still at that point in time we could not afford to buy the drugs from the US. So as a nation we also have to consider, as we build our healthcare system, to make sure to build our pharmaceutical, because they go hand in hand. And that's one thing that Cuba focused a lot on. They made sure that they make their drugs and can take care of making their drugs locally. So they unionized all their pharmaceutical companies and also subsidized medicine to people. So at this point, uh, if we can do a compare contrast, because also a very interesting thing about us is there was a study that was being done about the greens in Uganda, from dodo, nakati, and what that does for someone's health if someone continues to eat them. There's a lot of local indigenous knowledge about local medicines or herbal medicines that is not put to good use, because this system is one of thieves. What we have as herbal is people stealing and misinforming and making products just to benefit off of the desperation of the population, but it's not there to help act as medicine or remedies for the people. So I guess my question here is, how can we utilize what can we learn from what they have done? Because there's the healthcare system and the training of doctors, but we also need the medicine that goes into it, since it goes hand in hand. How can we reutilize some of their knowledge and distribute and merge it into our knowledge and our population in order for us to have something as well, that two different systems that function so well together, because they need to be together at the end of the day.
Yes, thank you very much. But let me break this down, and I hope people can understand this. You've mentioned that drugs were cheaper drugs were imported from India, then they came to Uganda, and they were not allowed to land into Uganda, and they were shipped back, and we were forced to buy from America, where the drugs are much more expensive. Now, the
Mm,
answer to that is corruption.
mm,
Nobody, nobody under the blue sky can tell a sovereign nation that don't let that land here. If Uganda bought them from India or from Australia or from Brazil, nobody can tell Uganda, send them back. You shouldn't allow Brazil medicine to come here. It is the corruption of our people, and they have been corrupted by the pharmaceutical companies and their foreign governments abroad, who are telling them, we'll give you $50. Don't allow those Indians bring their stuff here, so that we can monopolize this market. This market, we want it to be reserved for our products from New Jersey, period. And the stupid minister and the stupid chief medical officer in Uganda bows down to this kind of bull. You know what I'm talking about. And they are being bribed. And they are taking the bribes and they are making the country suffer. That is unacceptable. You can only do that under the NRM corrupt murderous regime, not the federal system we are talking about, whereby the Ugandans are in full charge of their country, not these foreigners. Okay? So that is going to be out. To the point of pharmacy, we have to train our people. We have to do research in our native medicine. And even, I mentioned that almost all the drugs, other than chemically produced drugs, most of real drugs are taken from plants. The pharmacy department at our universities should train pharmacists not only in the analyzing the chemical components of drugs, but also what I would call applied pharmacy, doing research in our herbal medicine to find out what is appropriate, what can be used to cure our diseases. For example, I think there is a plant called omuluruza. I think it works on malaria. Well, when we were growing up in the villages, our mothers would get that plant, squeeze it, and make a juice out of it, and give it to us. And there was no, by the way, there was no measurement of you have to get 5 spoons or 3 cc's or whatever, or ounces. No, they were giving us that liquid, and we drank it because our mothers didn't know how much quantity should be given to a child. But we drank it, and it cured malaria. Now, why don't we have our pharmacy department at Makerere or any other university that has a pharmacy department have some applied research department? Let our trained people study these medicines, these plants, and find local medicine for our local diseases. And I'll give you an example. My mother was an old woman when my sister-in-law died after she had given birth to a baby. 2 weeks after the baby was born, my sister-in-law died. And the baby was dumped at my mother's house because she was the only one to take care of the baby. Now, can you imagine an old woman taking care of a 2 weeks baby? She got some local medicine, took it, and she started producing breast milk for the baby and raised that boy. He's now a grown-up man. He's in his 50s, and he has his own children. Now you can see, if it was not that local herb my mother took, that baby could have died. A 2 weeks baby left without a mother. And being rural people in the village, there is no way. You talk about formulas here. You go buy them from a drugstore here or a grocery store here. There was no such a thing in my home village. But the local herb helped. And the boy is now a big man. He has his own children. Okay? That's what I'm talking about. Who has looked into that plant that my mother used? Can you adopt it, prepare it, and make it available to the women, not in my home area of Masaka, but also the women in Iganga, and the Teso, and the Hoima? That's what we are talking about. What is the use of having these universities and these departments of pharmacy, which cannot even help us in our local environment? This is where the Ministry of Health is going to jump in under the new leadership whereby the government is manned by indigenous Ugandans, not foreigners. But not only indigenous Ugandans, but people who have brains and who can think on the ground and are committed to serving the people. That's what we are fighting for. That's why we are on this thing. That's what UNN and UFCC is fighting for. We have to take care. We have to take back our country, which has been stolen.
And if the producer could please go on to the next slide, and if I'm to just, the idea here is not to be dreamers, but to actively position ourselves in what we envision. These are all things to be implemented. And one of the reasons why we chose Cuba as an example, as we said before, Cuba's healthcare system did not just come from them dreaming about that. There was a revolution that led to a healthcare system of that sort. We are going up against a lot of forces, but it's only until we go through those forces that we'll be able to install something of this nature. So, Senior, this brings us, of course, to the National Ministry of Health, and then you just hinted on it right now. But here it states that the Ministry of Health should be responsible for establishing adequate and state-of-the-art medical services to the entire population of Uganda. They shall be responsible for supervising all hospitals and dispensaries in the country. It will make sure that they are adequately equipped with supplies and equipment to deliver needed services and are staffed with well-trained personnel in every medical specialization as needed. The Ministry of Health shall establish specialized training in all medical fields, ranging from well-trained and specialized physicians to nurses and technicians in various medical skills. And if the producer could go to the next slide, please. So the following services shall fall under the Ministry of Health. This is the training of physicians in conjunction with approved medical schools in Uganda and abroad, nursing and medical technicians training schools, physical licensing boards, physician licensing boards, nursing licensing boards, public health and sanitation department, child development department, cancer research institute, dental and optical departments, tropical diseases control department, drugs and native medicine research department, an orphans department, infectious disease research department, HIV/AIDS control department, and also the pharmaceutical department. So, Senior, I think the only question I had in this regard is maybe for just for clarification, because I think I understand where it's coming from. The weight of responsibility that is put on the National Ministry of Health, because a lot of responsibility of the supervising and the regulation is taken off of the shoulders of the specific states and has been readjusted to be put on the federal government. So what pushed for this, and how does this help for us to have a uniform healthcare system across all the different states? I think that was the question I had in this regard.
That's a good question. I mentioned earlier that the federal states are the ones who are going to manage these services on a hands-on basis. However, the federal government is going to be responsible for policy. Now, when I talk about policy, we want to make sure that the quality is uniform. Because if you say Karamoja State is going to figure out the standards of nurses and medical doctors, and then Kabale, or rather Chigezi, is also going to determine. At the end of the day, you may find that the standards Kigezi designed are different from the standards Karamoja designed. And after a while, people are going to start complaining. The services in Karamoja are better than the ones in Kabale. So you were prejudiced against us, even when you were not there. Okay? So we want, you have seen this happen with this, Banyarwanda government we have today. When the COVID came, I think they brought, was it 17 machines, respiratory machines in the country? I think the number was 17. And 13 of them were taken to Western region, mostly Ankole area, and Kigezi. Two were left, I think it was two, no, three were left, two were left in Buganda, and another two, I think it was Eastern region got one, and the Northern region got two, something like that. But look at that. You have brought in 17 respiratory machines, and you are taking 13 of them to Mbarara and Kabade, and the rest of the country is left to share how much? Four. You can't do that. You can't do that to a country. But when we have a federal system, every state is going to get what they need. And the need is going to determine how many they will get. Okay? When we talk about having the same uniform standard of nursing licensing board, a nurse in Moroto should have the same qualification and would be expected to do the same quality of service as the nurse in Kasese or Masaka. So the national government is in charge of setting the standards. And also, these other institutions, like the Cancer Research Institute, we don't need a Cancer Research Institute in every village or every gombolora. No. We need maybe one or two. If they have a cancer, if the national government figures we should have a Cancer Research Institute in Jinja, we should have another one in Gulu. Okay, and those can serve the country fine and well. No problem. However, they would be there under the supervision of the national government, not the federal government. So most of these are going to be supervisory, it will be supervisory capacity, not functional delivery of service capacity. So they sound like too many, but don't be confused. The licensing board will set standards for the doctors, the
Mm,
nurses, the technicians, you name it.
mm. And also, I appreciate the fact that it's more, even though it sounds like a lot, their job is not to be involved in the day to day functioning as that is on the backs of the state, but it's to do
That's
more
right.
with getting feedback from the state and applying that in policy that can be uniformized for the whole nation. So it
Precisely.
ends up making sense and taking care of itself, where there is a feedback loop that will always go back to servicing what people need in every region, but that keeps a standard that avoids, those mishaps of having huge disparities across states. So if
Yeah.
the producer could go towards our last slide, and this is a very important thing, one of the most important things about healthcare that does not get addressed as much as it should be. This is the training capacity of a healthcare system in order to train and train its individuals and have more people trained and equipped to take care of this for the system to have longevity. So in training, it states that there shall be a robust training program in all areas of health services. While the training of our young people is going on at home and abroad, recruitment of foreign personnel shall be carried out by the Ministry of Health. The ultimate objective is to Ugandanize delivery of medical services in the country, that will be one additional contribution to put Ugandans in control of the management of their country. So I find this very interesting in terms of training, because as a nation, we have to consider training our people in within country and abroad, because we have to go and learn from other places and what they have done and the training facilities that they have. And also we have to be in a position to be able to import people to come inside the country and train our people on different, especially the specialized units. A lot of training goes into that, and in order to have these specialized programs. So, Senior, I wanted you to speak on training and why training as a facility. I can understand why it's put under the Ministry of Health, because this will have to do with also how they set up the regional medical schools in all the universities. But also to just briefly go over why this is important. This is an important engine to the healthcare system as a whole, because training also does bring in the aspect that you talked about, the medical ethics. This is where all this gets covered and implemented into the system.
Yes, it is self-explanatory. We have to train our people in all fields of medical services. Let me put it at a practical level. Picture this: a woman or a man brought to a hospital in Moroto, Karamoja. This poor person doesn't speak Luganda, doesn't speak Swahili, doesn't speak English, only speaks Karamajong. And he is there trying to explain the doctor or the nurse what is bothering him or her. And the doctor is trying to explain what, first of all, the doctor must understand exactly this person and the environment this person lives in and the language. If we did not train a Karamajong to be a doctor or a nurse, then you may end up looking for a translator, which may not be easy, but it will be double expensive. However, this person is lying there or is being treated in the clinic, and the doctor or the nurse says, "Open your mouth," and the poor woman doesn't understand. What are you talking about? I'm speaking to you in English. Open your mouth. Close your eyes. Turn this way. I mean, come on. If we had a trained Karamajong, this wouldn't be a problem. Because when I go to these hospitals here and the doctor tells me, roll up your sleeves, he doesn't need a translator to tell me how to roll up my sleeves because I understand the language. That's one thing. And the doctor can even talk to me and tell me what I should eat and what I shouldn't eat based on, my illness I'm explaining to him or her. We need to train our people. There is no shortcut to that. And we need to train them in every field, from being a surgeon to being a radiologist to being an X-ray operator. We got to train them. Now, in the meantime, we do not have enough supply of these people. There is nothing wrong with hiring a Filipino. I mean, you've seen this in all these countries. How many nurses, medical technicians are Filipinos, Nigerians, Ethiopians,
Most
you
of,
name it.
most of the healthcare system here is run by foreigners.
Well, you are right. And let me tell you something. If you tried to put all the Indian doctors on
Mm.
one plane and ship them back to India, 99% of American hospitals will close. Why
Senior,
is it that if you go to India, you are
mm,
not going to find Chinese or English or French doctors? They are Indians. So what has India
mm,
done? They have trained their people to the point that they can even export the surplus.
mhm.
Don't you think we can do that too? Yes, we can.
Yeah,
We can export the surplus.
we
Okay?
we're doing it. We're doing it right now. What I find, I had even forgotten. My family doctor here is Ugandan.
Well,
My
my
family doctor.
family, my doctor is a Kenyan.
Yeah.
And before that, I had one from Peru.
Mm,
Can you imagine?
yeah.
It's ridiculous. And now, in Uganda, before ours are trained to the point of having enough supply like the Cubans or like the Indians, we can
Mm,
bring in foreigners
mm,
to work. Like I said, the Filipinos or the Indians or even a Kenyan can come and work in a hospital in Kalisizo or in Iganga. But after our boys and the girls have been well trained, then they can come and fill the gaps and take care of this work. Now, we need to we need to train our physicians or our medical staff even overseas. I have personally seen Ugandan doctors coming to John Hopkins University to train in so-called, I think they call it masters in public health. I remember
mm,
some years ago, I met a Ugandan lady who was a physician, a graduate of Makerere University Medical School. She said when she got to John Hopkins in Baltimore, she was overwhelmed with how much her peers that she was attending class with knew compared to
mm,
hers. And she said, I didn't even know how to use a computer. A simple thing like that. And then she
mm,
said, some of my classmates are talking about some medical discoveries that I've never heard of, but they have been reading them in the literature they have had at their universities when they are doing their degree in as medical doctors. And yet she had
mm,
not read those kind of things when she was at Makerere. No, we need to upgrade our training to be at par with the international community so that our young man or woman who is coming here to specialize in whatever it is cannot feel like she's a third grade level of a physician, because we're going to send them out to specialize in being eye specialist, in being whatever open heart surgery specialist. You name it, we're going to send them out to different countries, and then they come back and they serve in Uganda. Now, with other skills which we do not have schools for example, I don't know if we have a special school training X-ray technicians, but we can build these. If they are not there, we can build them and train them, and then be able to bring in the machinery so that we can distribute the machinery in Moroto, in Hoima, in Kitigum, and then we send our own boys and girls to work on them and serve their communities. And by the way, we should be very selective. If we are going to send you to Kitigum, we should send an Acholi, because the local people can easily communicate with you when you
communicate.
are doing the
Sure.
yeah,
Mm,
don't send a Munyamore there and can't even understand what the Achoris are talking about unless he knows Acholi language. But it would be better to send a native boy or girl there.
yeah, no, I think we have, I'm not sure how many we have, but I know we have one radiologist school. This one is in Barara. So even the distribution of them nationwide is not is not proportional to the need of the population, but is rather, as we know what this government has decided to do with isolating
Mhm.
of especially the western region and proclaiming that to be their home of heritage and trying to draw a wedge between that state and other states within Uganda. So it comes as no surprise that most of the healthcare research that's being done is at Mbarara Medical Institution, like the university there. But with that being said, Senior, I think we have covered a lot of not only these are not just things to pick our interests, but places where we can start to imagine ourselves, if I must say, and work towards. These are goals. These are goals to work towards, and this is things we can achieve. And we can only get there if we push ourselves, uh, if everyone does their part. This revolution is not going to bring itself to the brim individually, but everyone has to kind of do their part. Senior Chintu will come here when he needs to come here and give us the knowledge that we need to get from Senior Chintu. But he also has his other role that he's feeling. So the question you should be asking yourself if you're watching us is what is the role that you are participating towards, and how are you participating towards it every day? And if every day is too much for you to put your brain around, start to think about every week. How are you contributing to your role in this that does not just involve just watching us? So, with that being said, Senior, we're going to go into our question segment. We've been here for a while and we're towards the end of our program. So, we're going to answer to any questions, comments that members in the audience might have. The studio number is on the screen, but we're soon going to close down, with that being said. So, this one came from Mulindwa from the US. So, I'll go ahead and play this.
Mbalamusizzaako bannaye mikwano gyange Desire weebala omulimu ogwo omukulu Kimbugwe mutumidde nnyo bannange mwebale nnyo emirimu egyo gye mukola. Senior Kintu kutumiddeko nnyo naawe wabula kyensaba bwe buvidiyo obwo nze bunkolera nnyo. Badde nsaba bwe kiba kisoboka otuteekereko ku WhatsApp tujja sobola bulungi nnyo busaasaanya abantu bafune amawulire mu ngeri ey'enjawulo. Mbalamusizzaako nze kye mbadde nsaba mwebale nnyo mwebalire ddala baakaliza birungi byereere.
Thank you so much, Mulindwa na Fetulamusiza. And I think that if Liberty is on here and a couple of other people who cut down these videos and make them into smaller clips, so that they have had and are going to go ahead and do that part. But with that being said, thank you for calling in. Thank you for sending your message. And even if you're new on here and you're watching today and there's parts of this presentation that you feel need to be cut and redistributed, take it upon yourself to do it. Ubanga, sometimes when you really want something done and you do it yourself, then you can see it produce fruits right in front of your eyes. So this one is from Baker from Busoga National State. I'll go ahead and play Baker's message.
Yes, Desire ni Mr. Kintu mwebale kuweereza mu studio da UN. Ekibuzo kyange kijja mwami Kintu. Is Madam Ruth Chenge watching the program? Our work should be done. Or she's in her bed enjoying herself with her husband, taxpayers' money. If she's not watching the work, how it is done, then let her wait. Let her wait for the Chibokos. She's going to tell us where she took her money. Because we see her, she's constructing apartments. The are growing like mushrooms in Kampala every day on her land. Thanks for the show.
Senior Chito, would you like to respond?
Well, that is a case of corruption. And I believe when the NRM regime is dumped in Karuma Falls, the people who will be in charge of the country are going to find ways of dealing with the people who are corrupt, who have robbed the country, who have destroyed the country, and they will be given appropriate punishments. Now, with regards to properties, like you've said, I think you said apartment buildings or whatever, mushrooming all over the Kampala, owned by these crooks and criminals. Well, the good thing about it, even if you run out of the country for your safety, I don't think you can put those apartment buildings in a briefcase and run away with them. So the new people will take care of those properties and they decide which way to go, what to do with them. I have heard of some countries whereby there was a revolutionary change, got rid of corrupt bastards out of government, and they took their properties and they donated them to institutions. For example, Makerere University is there. Some of our high schools and others institutions are there. Those buildings can be properties of that, and they will generate income from renters. And that income goes to support that university or that school or that hospital, whatever, or the National Theater for that matter. Some of these establishments have properties, but this would be an easier way for example, the National Theater to own some properties which give it income that can support it. I think I have answered your question, but definitely, whether she's alive or dead or run away, she ain't going to own those buildings any longer. Just as much the other people will not own those fleets of cars, because those fleets of cars are going to be the new ambulances in the country.
Or the helicopters.
Yeah.
And this next one, this is a message from Mayembe, so I'll go ahead and play it from Kayunga.
Abaweereza baffe mwebale nnyo okutuweereza era nga tusanyuse nnyo okubalaba. Ebyobulamu ensi gegamu ku masiga ensi kwetambulira kuba abantu bwe babeera abalamu, emirimu abantu bajja kukola, abantu bajja kuzaala, abantu nga balamu basobola okukola emirimu kuba basobola okulabirira abaana baabwe. Kugamba ensi bw'ebeera herese buli kimu kitambula bulungi. Naye obuzibu bwe tulina ze gavumenti zino zitufuna enzibi. Bw'oba otunuulira nnyo ebintu bino osanga omuntu n'akugamba federo tesoboka biki. Naye ng'ekikwewuunyisa ng'ali mu mawanga ga magulu meero ebyo gye muli, kyokka ye yeegalira mu federo. Naye n'akugamba nga federo mu Uganda bwe tesobola, n'omubuuza nti ki lwaki tesoboka. Bino ebintu bya wano mwami Kintu nga bw'abyogera tewali buzibu nakamu. Mwami Kintu agenze alina ebintu byayogedde wano kale nabulemu biki nayogera byakabandagwa eno mu ntuusi. Ekikwewuunyisa nti ebintu byonna mwami Kintu byamenyaawo. Obulwaliro obwo gye buli bu dispensaries kuba awo eyo rodi yali federalism nga tugirina gyebiri n'ebitundu ebirala byonna gyebiri. Ekintu ekyaleeta obuzibu actually federal egenda kutwanguyira nnyo wano mu Uganda kubanga ebintu mwami Kintu nga bw'abyogedde wano just kubi implementinzi kuddamu kuzimba mu malwaliro ago just gaawo omuggoka temukyali mazzi temukyali biki n'ebintu bifu. Ninga ezo dispensaries gye ziri ku magombolola gye ziri tewali kitaliiyo. Naye bano kye baakola bajjamu eddagala ne babbamu ebintu byonna ebyuma just kuzimba bizimbe kubisiiga langi kubitereeza. Ensonga lwaki nkugamba nti federo egenda kutwanguyira nnyo. Kuzimba bizimbe kubizaamu ddagala, kubizaamu byuma, kubizaamu kuleetamu bakozi bakole. Eggwanga abantu tukaaba emirimu, naye emirimu mwegiri miyitirivu. Kati just eno yokka sekita y'emirimu eya health yokka ng'okutte kweyo, bantu bameka bafuna emirimu. Abaana bangi nnyo baddusi bavudde mu ggwanga basoma ebintu bya nansingi, abantu basoma ebintu bya medicine, bonna eggwanga balidduka mu buddusi. Ebintu bisoboka bulungi nnyo. Eno ensinzi bwe mandaba wano emyaka 2 gyokka bannayuganda tuli successful nnyo okuba nti Katonda yatuwa buli kimu wano kye tusobola okukozesa. Emyaka 2 eno Uganda eba efuuse nga amata g'e Kenya agatafa. Yes, eba erabika bulungi nnyo, ebintu byonna nga biteredde butufula ebintu federo nejja bulungi. Nze mbagambye bino ebintu byonna weebiri just kuddamu kubanga erettako bazimanga obulwaliro kwebiri, ebizimbe weebiri, just kuddamu kukola, kuddamu kutereeza mu butereeza katono nnyo ng'ebintu bitambula. Naye osanga bannabyabufuzi baniira ebintu nga balemesa biremese. Lino eggwanga lyetulimu ffutwa, just mitima mibi egy'abantu. Singa Uganda, singa bano abantu abaali bafuga ensi, singa baali bagyagala, Uganda singa eri wala nnyo 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 nnyo. Kuba Uganda abantu bakozi bawa omusolo, naye ssente nga bwe tuzikwata ne tuziwa mu misolo, zonna bwe bazikwata ne bazimba amawanga amalala, zonna bwe bazikwata ne bazibba, zonna bwe bazikwata ne bakolamu ebintu ebyabwe, zonna bwe bazikwata ne bagulamu amamotoka agaabwe ne balemu okugula n'ambulances. Kintu kitalo nnyo nnyo tuli wano tubonaabona obubonyi n'abantu abatono ennyo abatuzinya oluguje ebisezengere byennyini ebiwedde emirimu. Ndowooza kati bijanafuuka nabiwunandugu. So abagenyi baffe mwebale nnyo okutuweereza, tusiima bannange, muyambe UNN, muweeyo obuyambi bwa ssente, tubwetaaga, tukyabwetaagira ddala tusobole okutambuza emirimu gino, oba basobole okutambuza emirimu ebintu bitambule. Eno ensi yaffe tetugirekerera. Mbadde ndaba wano ku bipande, ono Kyagulanyi ajja agenda amayuka, simanya ate agenda na Dubai kukolayo concert, mbuba simanya basonde ssente bannayuganda bano. Ze twasooka okubawo oba ze basooka okubawoza mwalemu okututeekako accountability musitulage engeri gye mwazisaasaanyaamu, ate kati mwagala ndala. Kati mwagala ndala. Naye bantu mwoba mutulabako obwoya mutuyita mbuzi. Bannange kankomwawo mukuume mayembe.
Amen. And Sina, I think that's our last message for today. Would you like to respond to Mayembe?
Yes, Mr. Mayembe, thank you for your comment. We appreciate your advice. Mr. Mayembe has zeroed in on a few things. First, he has tried to explain in details how bad this government is, that they are responsible for all the damage done to the country. He has also told us that the infrastructure is there. They only destroyed it. I want to add on something. They didn't only destroy it, but they stole the machineries or the equipment that was there in the infrastructure, and they took every equipment to Rwanda. These are thieves. They stole our stuff. And by the way, we are not, when we talk about stealing, they didn't only steal medical supplies or medical equipment. They even stole machineries that were the machinery in the gineries that were handling our coffee, especially in the Masaka district. They stole the machineries, took them to Rwanda. So you can see, but we are going to rebuild this because we're not going to go to Rwanda and pull those machines back. After all, they are now old anyway. We are going to build with new and better machines. and let them keep the old machine, a bunch of thieves. Now, talking about rebuilding, you are not going to rebuild Uganda unless you get good leadership. You need good leadership. You need a federal system of government. And I hope and pray that the federal system of government is going to give us responsible, responsive, and transparent leaders that can rebuild this country. This country needs good leaders to rebuild it, not people who are just interested in themselves or trying to, to pop up their own egos. No, that ain't going to build the country. We need people who are going to build the country, who are focused on serving the population. It is interesting, by the way, talk about service. Some of you may have heard some statements which were played on the news media that the late Elizabeth II, Queen of England, in one of her speeches, saying, I am a servant, or I'm here to serve my people. And even King Charles repeated the same concept of serving his people. But you remember what that Munyarwanda said? I am not a servant of anybody. I just work for myself. Now you see the difference. You can see the difference. That's what we need to eliminate in our country. This Munyarwanda has to go back to Rwanda, and we have to reclaim Uganda and serve our people, period. Thank you very much. I appreciate your comments, Mr. Mayembe. Keep up the good spirit. And then, before I close, don't ask what Uganda is going to do for you. Ask what you are going to do for Uganda.
And with that being said, Senior, I'd like to invite you for your closing statement for today. And I'd like to thank you for being here with me today, and the patience that goes into making of these programs, the research work that goes into uh, making sure that the material is there, and of course then the patience and and the grit that goes into watching, like sitting here and actually doing the program for the amount of hours that we do sit here and do them. So I'm grateful and thankful for that, and you always being ready and able to come and share your knowledge on a vast and a range of topics, especially that has to do with policy writing, because that's the problem we're facing. We don't have any public policies to offer services to our people. We don't have people who are seriously writing policy for our nation, and we don't have any serious service departments. It's even a joke to mention service providing in Uganda, because the only service provision that is being offered is you knowing that your resources and funds are going to be stolen, corrupted out of the same nation. So I want to thank you for always being ready, able to come and offer a range of knowledge, over a range of topics. For all of us youngins and also seniors and anyone interested really in the nation and building back the nation, where we can, start to listen to what you're saying and take points from what you're saying, and also facilitate our own research and growth that will later be put in within the efforts towards rebuilding the nation. So, with that being said, I'd like to invite you for the closing statement, and I appreciate you being here with me today.
Thank you, Desire, for that pumping my ego. I want to make a correction. I am very grateful for God having given me a very good team of people that I work with, and I have worked with for many years in this struggle to save our country from these invaders who took it over. Yeah, all these ideas Yes, I contribute, but I have a team of people who help me put these things together. And I'm very grateful to them. I owe them a ton of thanks for their assistance in researching and putting all this information together. All I can do is type it and present it. Now, I want to thank Desire for your contribution in putting up this program every Sunday. And I thank the technicians, the producers, the managers, and including the office sweepers in CNN or UNN studios. So, as a team, we are all working towards one goal: to rescue our country from those who stole it. Everyone contributes something. There are people who are going to be scared of contributing for various reasons. There are people who are going to be envious of our contribution. There are people who are going to be jealous, or that people who just don't like our looks. That's okay. But you know what? There are some people who like our looks too. So we are going to go ahead until we save Uganda from these people who stole it. And whatever you can do, as I've said to Mr. Mayembe, quoting the statement of the late President John F. Kennedy, don't ask what Uganda can do for you. Ask what you can do for Uganda today. And Uganda needs you. Uganda needs me, needs you, needs everybody. Thank you very much, and hope to see you again next time around.
Thank you so much, Senior Chintu, for that. And thank you for also highlighting that, because we forget, or members in our audience might forget, because you might see me here, or you might see Omlanga here, or you might see Senior Chintu here, and think that these are all individual efforts that need to be left up to those individuals to fulfill them. Even the work that we do bring here is teamwork, from not only from within us as a team, but also other people who have teamed together previously. So I guess all I'm trying to say as we close, from what Senior Chintu has said, that we can learn from this is to have everything delivered as we want to, and to reclaim our nation back and start to rebuild services into our nation and guarantee it for our descendants, we have to work as a team. Everyone has a role to play, everyone has a contribution to make, and these contributions are not isolated. They are not once and then you can sit and wait. They are continuous. Continuously look for where you fit in, where you can help push motives, where you can contribute. Do not leave it up to people. There is no revolution that is going to be delivered by one person. It's a group team effort. It might have a face to it, but it is the masses behind those faces that do push through that revolution. Ultimately, everything belongs to any change that has occurred for not only African people but also for Ugandans has been delivered by the masses, by the teamwork, by the group effort, by all of us being involved, bothered, agitated, and ready to act upon our reality to be able to change it to have a different reality. Until we all are actively involved to that level, we will not get what we want. They're ideas until they're realities. Any idea in this world can be implemented and turned into a reality. And even what we're speaking of today already exists, and examples given out of Cuba. So it is on us as Ugandans, especially the ones in the diaspora, to decide when we begin acting, how we begin acting. The options have been provided. We've been here for a long period of time now. We're going towards 2 years. We all know the reality of what we face, its depth, and we know who the enemy is. The question is, are we ready to actually actively start working in an organized, in an organized way? which is the option is also there with UFCC, and be involved actively without excuses towards our own liberation. That question I leave to all of us, because now one person who comes here on UNN and does a presentation is going to do that for you. The job has always been left towards Ugandans. Now one Ugandan, not two Ugandans, not three. It is a collective effort of Ugandans in the diaspora that is going to deliver any sort of liberation, of which it won't only be Ugandans in the diaspora. Ugandans in the diaspora, you can kickstart it, but we're going to also need the Ugandans, the ones who are back home, to be able to carry over that momentum and for us to feed into each other's momentum to really liberate ourselves and change the status quo in Uganda right now, which is needed. It's been decades, it's been generations of stagnantness. It can only mean now that Uganda can actually really spark a change, but it has to be revolutionary. It cannot come it cannot come to us without any revolutionary means. So ask yourself, what's your role? What are you doing towards that role? How are you involving yourself? And with that being said, I'd like to thank you all for being here. And keep in mind, always remember, it is teamwork. Nothing we do here is brought upon you just out of our individual genius. We're learning from different people. We're learning from different revolutions. We're learning from different communities. And we're bringing that together through a collective effort. So if we continuously remind ourselves to work together, we can actually reach the tip of the goals that we want. And we can push this further down as a culture, as a tradition, because that's how it ought to be. But with that being said, I'd like to thank you for being here with us today. Thank you for listening in, tuning in, being here with us, sending your questions, sending your comments, getting involved. And I want to thank you for any future participation that you do towards our nation, because, you know, still my descendants are going to be descendants of this nation. And I'd like to know that we are collectively worrying about our descendants and the people who are going to come after us and what we can do for them. So until next week, I'd like to wish you a good evening, good morning, good afternoon from wherever you're watching us. This was the Tower at UNN. Thank you for tuning in today.
I hear some people saying that I am their servant. I'm not a servant of anybody. I am a freedom fighter. That's what I do. I don't do it because that I'm your servant. I'm not your servant. I am just a freedom fighter. I'm fighting for myself, for my beliefs. That's how I come in. I'm not an employee. If anybody thinks he gave me a job, he's deceiving himself. I am just a freedom fighter whom you thought could help you also.
Do you wake up sometimes and feel, you know what, this is too much for me. This is too much. You don't feel appreciated enough.
It doesn't matter because I'm not working for. I'm working for myself. I'm not working for other people. I'm working for my grandchildren, for my children. And you call me a leader? I am an enemy of the people. I am Exirani.
Sorry?
I will be Exirani. I will be a curse to the people. And you call me a leader?